Hello friends, once again welcome back to my YouTube channel. Today we are discussing about second part of obstetric and gynecology. Before that, if you are not subscribed my channel, please subscribe. We can see the questions and answers one by one. And the first question, from which week onwards quickening felt by mother? And the options are at 12th week, at 8th week, at 10th week and at 18th week. From which week onwards quickening felt by mother? And the answer is 18th week. The quickening is the perception of active fetal movement by the woman. It is in primigravida it is 18th week and in multigravida from 16th week onwards. And the next question, which term is used to refer the relationship of long axis of the fetus to the long axis of maternal spine? The options are lie, position, attitude and relation. Which term is used to refer the relationship of long axis of the fetus to the long axis of maternal spine? And the answer is lie. The commonest lie is longitudinal lie. And the next question, the part of fetus which occupies the lower pole of uterus is called? The options are position, lie, presentation and attitude. The part of fetus which occupies the lower pole of the uterus is called? And the answer is presentation. And the next question, the relation of different parts of the fetus one another is called? The options are lie, position, attitude and denominator. The relation of different parts of the fetus one another is called? And the answer is attitude. The universal attitude is flexion. In the next question, arbitrary bony fixed point on presenting part is called? The options are lie, position, presentation and denominator. Arbitrary bony fixed point on presenting part is called? The answer is denominator. We can see the denominator of different presentations. In vertex presentation, the denominator is occiput, and in face presentation, mentum, brow presentation, frontal eminence, breech presentation, sacrum, and in shoulder presentation, acromion. The next question, the relation of denominator to the different part of the pelvis is called? The options are position, lie, presentation and attitude. The relation of denominator to the different parts of the pelvis is called? The answer is position. And the next question, how many positions are there in each presenting part? The options are 7, 6, 5 and 8. How many positions are there in each presenting part? And the answer is 8. And the next question, which of the following is the commonest position in vertex presentation? The options are LOA, LOP, ROA, ROP. Which of the following is the commonest position in vertex presentation? And the answer is LOA. LOA means left occipital anterior. The next question, in pregnancy, biochemical tests are done. The options are for assessing height of fetus, for assessing renal anomalies, for assessing pulmonary maturity, none of the above. In pregnancy, biochemical tests are done. And the answer is for assessment of pulmonary maturity. The next question, from which week onwards the fetal movement count should be performed daily? The options are 12 week, 28 week, 18 week and 20 week. From which week onwards the fetal movement count should be performed daily? And the answer is 28 weeks. The next question, which is called as welcome sign of labor? The options are false pain, softening of cervix, lightening, all of the above. Which is called as welcome sign of labor? And the answer is lightening. At the end of the third trimester, the baby settles or drops lower into the mother's pelvis is called lightening. The next question, deflection of the head in relation to the pelvis is called? The options are engagement, descent, asynclitism and flexion. Deflection of the head in relation to the pelvis is called. Answer is asynclitism. In the next question, name for the central separation of placenta. The options are Schuler's method, Matthew Duncan method, Clemens method, both A and C. Name for the central separation of placenta. And the answer is Schuler's method. And the Matthew Duncan method is marginal separation of placenta. The next question, what is Hart's rule? The options are rotation by law of pelvic floor, pelvic shape, law of unequal flexibility, both B and C. What is Hart's rule? And the answer is rotation by law of pelvic floor. The next question, who is first devised partograph? The options are Clement, Robert Honk, Friedman, William Endovan. Who is first devised partograph? And the answer is Friedman. The partograph is a graphical record of cervical dilation and descent of the head against duration of labor hours. In partograph, there are three phases, that are latent phase, active phase and transition phase. We can see the phases one by one, and the first phase is latent phase. The duration is 6 to 8 hours. Cervical dilation is 3 to 4 cm. Uterine contraction is every 15 to 30 minutes with mild intensity. And the next phase is active phase. In active phase, cervical dilation is 4 to 7 cm. Uterine contraction every 3 to 5 minutes with moderate intensity. The next phase is transition phase. In transition phase, cervical dilation is 8 to 10 cm. Uterine contraction every 1 to 2 minutes with a severe intensity. The next question, which position is preferred for delivery? The options are supine position, dorsal position with 15-degree left lateral tilt, lateral position. Which position is preferred for delivery? And the answer is dorsal position with 15-degree left lateral tilt. In the next question, why dorsal position with left lateral tilt is preferred for delivery? The options are to avoid aortocaval compression, to facilitate pushing effort, reduce pressure on baby, both A and B. Why dorsal position with left lateral tilt is preferred for delivery? And the answer is both A and B, that is to avoid aortocaval compression and facilitate pushing effort. The next question, umbilical cord consists of how many blood vessels normally? The options are 1, 2, 3 and 4. Umbilical cord consists of how many blood vessels normally? And the answer is 3, that are 2 umbilical arteries and 1 umbilical vein. And the next question, another name for intrauterine adhesion is, the options are malformed adhesion, adhesion in utero, synechiae, both A and C. Another name for intrauterine adhesion is, and the answer is synechiae. And the next question, MTP Act has been enforced in the year. The options are April 1972, April 1954, April 1942, April 1985. And the answer is April 1972. And the next question, the encysted blood collected in pouch of Douglas is called. The options are pelvic hematocele, hematometra, hematosalpinx, none of the above. The encysted blood collected in pouch of Douglas is called. The answer is pelvic hematocele. The next question, grand multipara is live birth more than. The options are 3, 2, 5 and 10. Grand multipara is live birth more than. The answer is 5. The next question, percutaneous umbilical cord sampling is, the options are chordocentesis, amniocentesis, colocentesis and pericentesis. Percutaneous umbilical cord sampling is, The answer is chordosynthesis. The next question, WHO recommendation of antenatal visit should be at least. The options are 10, 6, 4, 8. WHO recommendation of antenatal visit should be at least. Answer is 4. And the 25th and last question, the hormone which do not cross through the placenta are. The options are insulin and parathormone, parathormone and calcitonin, calcitonin and insulin, insulin and thyroxine. Hormone which do not cross through the placenta. And answer is parathormone and calcitonin. Thank you friends. Thank you for watching. Please subscribe my channel for more videos. Please like and share this video. Thank you.